Alzheimer's disease is a form of dementia. Alzheimer's dementia causes change in memory, causes change in language, as well as sometimes in personality. These changes happen progressively over time and eventually will impair a person's ability to take care of their own needs. Dementia is kind of an umbrella term to describe a cluster of symptoms, usually impairing memory and other cognitive functions, but there are various forms of dementia. So Alzheimer's is the most prevalent form, but there's also vascular dementia, frontotemporal, Lewy body, as well as a host of others. About 11% of Americans have Alzheimer's disease, so this is just under about 7 million people in the United States, and for Tennessee that equates to about 130,000. Here at Tennessee Valley, we care for about 7,000 veterans with some form of dementia, not just Alzheimer's disease. Dementias progress over time. Usually it happens in older adults, but can happen in younger ages. For Alzheimer's specifically, it develops once your brain starts to have plaques and tangles within it, and those plaques and tangles can actually develop years before someone may develop symptoms. And so by the time you're starting to notice changes in memory or language, it's pretty progressed at that point. So some dementias can have a genetic component, but there's many people who develop dementias, even Alzheimer's, that have no known family history of the disease. And then there's some that we would consider more acquired. For instance, a vascular dementia happens when you have maybe strokes or mini strokes known as TIAs, and over time you'll see changes in the brain. In VA, we use what we call the dementia warning signs to guide assessment and diagnosis of dementia. And so if someone starts to notice changes in their ability to remember common things or to do common activities such as making their morning coffee, if they're having difficulty where they're asking the same question over and over, or even getting confused about day and time, those are some signs and symptoms that they would want to bring to their doctor and go ahead and proceed with a screening or assessment at that time. Here at Tennessee Valley, we have a whole host of services for veterans who are looking for a potential assessment or diagnosis of dementia. Once diagnosed, maybe through our neurology clinics, neuropsychological assessment, then they could potentially qualify for some rehabilitation services, maybe through speech therapy or occupational therapy. And those services, they may not be able to reverse the dementia, but they can maintain one's functioning for as long as possible. And for caregivers, we also provide support. We have classes to educate on what dementia is and how to manage those symptoms at home, as well as providing functional support for caregivers. Here at Tennessee Valley, we have one of 20 geriatric research, education, and clinical centers here in the nation. And we are fortunate to have researchers here at Tennessee Valley working on research to understand the causes of dementia as well as treatment options that may be available in the future. Some of the research here is also looking at how COVID may have an impact on the development of dementia later on. Dementia is not a normal part of aging. So if you're starting to notice changes in the way you're thinking, remembering things, or your ability to take care of your daily activities, please talk to your provider. Early detection of any kind of dementia symptoms is crucial to understand why it's happening and potentially to allow treatment that may either stop or even reverse, in some cases, the cause of dementia.